colleagues, one of the most expected lectures in Bled courses is Joker, and of course by Professor Igor Schwab. Therefore, Igor, the floor is yours.
Thank you, Matea. As always, I'm very pleased and honored to deliver the Joker session. This is the number 17. So, just for the ones that are online and are not familiar with the Jokers, I always start with this slide, which is describing what the Joker session is all about. It's a session that technically you put in a curriculum or a program that you organize, and you don't know how to fill this content. So you put in something called a Joker session, which means that you will fill the content afterwards. And it really depends on what the topic is. And for this, you can quite usually ask some of the participants to reflect on what has been said during a long course, or somebody to deliver an ad hoc lecture, or a lecture that has been prepared. So this is technically a Joker session. This was usually aimed to take another view of the subject, and during the Bled courses it has become a tradition to present something that is controversial, perhaps interesting. It was first introduced in 2004, and I remember that Justin Allen was at that time the course director, and this is where when we have introduced it. And over the years, the Joker session in Bled has developed into something more different. It is not a session aimed at the course. It is a session that is unexpected and is something new. It may or may not have any bearing to the content of the course. Usually, if you are asked to deliver a Joker session at a course, my advice to you is don't do it, because it is difficult. You have to prepare something in advance, and if you're doing this for the 17th time, it's even more difficult because everybody is expecting of you to be brilliant, and you're not always a brilliant person. So most of the Joker sessions are not well rehearsed, mine certainly not. It's always something that I've been thinking over the weekend and the nights, and wondering whether people will understand what I have the aim of telling them, whether the message will be right, whether it will be something that will make you think. Because the main thing about the Joker session is to make people reflect. That's the main aim, actually, of every lecture. It's not about stuffing people with data, because there are other methods for that. But if you want to give a good aim of a lecture, the aim should be to make people think about what you have said. So far, it has always been done by me. And topics have been different. Some have been very funny. Some have been terribly depressing. Morbid. And people still remember the morbid one. It was only one. It was the one how to care about a dying doctor. Okay? But this year, the topic is not morbid, all right? So what is the aim of this session? The first of all is that you will remember the year 2017 and the Joker session of 2017. Now, people that have been here in 2017 are, thinking about what was that 3 years ago that we were talking about, and okay. Then you will learn about some new tricks and how to deal with them. You will think about how to influence students' attitudes. And in the end, of course, what is very important, it has a relevance to this course, is how is family medicine important, and how the teachers of family medicine are important in shaping the attitudes and beliefs of students and future doctors. So, what was the choice, the overall choice? What do you think was the main topic I was thinking of? Yeah. So the choice of this topic was easy. It was this damn thing that is making our lives so miserable, that is making everybody's life so miserable. And you can talk about COVID-19 from a lot of perspectives. So the thing is, what kind of perspective about COVID-19 to choose for this course? Of course, I could talk about general issues, like that this is a worldwide problem, showing how different countries are facing the same thing, how our personal lives have been changed, how isolation has affected each and every one of us, how we cannot meet as we want, we just don't go to see each other so often, we don't go to parties, we don't go to big gatherings. It's also about anxiety that this thing is creating among people worldwide, and we are seeing a great increase in anxiety and anxiety-related disorders. I could also think about how our professional lives have changed, how we as doctors are overburdened with another challenge we have to face, how we had to devise new methods, how to react to patients' requests and the requests that have been created by this disease. I could talk about health services organization, how, again, it has been proven that primary care is the key element in dealing with COVID successfully, that countries that have a good primary care system, good family medicine, have obviously managed much better under the threat of COVID. These are all the general issues, and each of them is very important. I could talk about medical education. How has COVID-19 affected medical education? And it has affected medical education very much. We have safety issues, the issues how to take care of the students that they don't contact disease. We have the teachers' issues, and most importantly, we have the issues how to prevent disease being spread to patients in primary care or at hospital wards, how we protect these quite often very vulnerable people from infecting the disease, from getting the disease from students or others. Of course, also teaching techniques had to change immediately, overnight. We switched to online. We stopped delivering lectures. Big seminars were over in a matter of 2 weeks. And there were big problems how to organize practical teaching, because hospitals said, we don't want to see students anymore. Doors are closed. And then slowly we are now reintroducing students back into clinical teaching, and how are we going to do this safely and well? And of course there is an issue of how to change the assessment methods, because you can't have a big classroom full of students delivering tests and writing up tests and OSCE stations. All these things are very, very... So you had to change assessment as well. And of course, this is the end of congresses as we know them. And some of them most of the congresses stopped overnight. And we are now trying to find out new ways how to deliver, and this, what you're doing with Bled course, is one of these experiments, how to go on delivering, presenting things in a better, on a different way. And last week we also had the first Congress that was held live, but under a different situation. But one of the most important, interesting things was COVID-19 related issues with ethics and professionalism. A lot of things have happened. Things that we are not aware of, we're not expecting, stigmatization of patients that have been diagnosed with COVID and got home from hospitals, were stigmatized by their environment, and they were suffering terribly. We have problems with access to care of people that don't have COVID but they have other serious diseases, and they just can't get services. And how are we going to manage them, because they are our patients? And if you are a narrow specialist, if you are just a COVID-19 specialist, it doesn't concern you. This is not your issue. But if you are general practitioners, you have to take about care of everybody. And how are you going to deal with that? Some people have not been cared for. There have been terrible stories of people in homes for the elderly being left abandoned without care, and being found out by other people in terrible conditions. This is certainly a bad example of professional behavior. We have seen, especially in the first wave, doctors in despair because they couldn't manage the issues and the problems that they have faced with. And doctors that have been in burnout, they said, I just can't cope with this anymore, because it was just too much. It was too emotional, it was too much work, and you just can't do it. So I think ethics is one of the fundamental things in education that needs to be taught well. And this is when I come to Joker 2017. If you remember the 2017 Joker, it was about how students cheated tests. And we have seen that over the past 10 years, students have set up highly effective methods to cheat at exams, especially at recalling data. And this is an ever-developing field with, where we as medical educators do not play a role. There is tremendously little knowledge among professors about methods students use to cheat, which is, to my belief, unacceptable, but okay. This is important because unprofessional behavior in medical school is associated with unprofessional behavior later as a doctor. So this is not a small issue. And cheating in exams damages the validity of assessment. So if you have an MCQ, which is a good method of assessing knowledge, professors will tell to you that they prefer oral exams, which are worse, but at oral exams students can't cheat. So they think oral exams are better. And we have all these discussions at the medical faculty. And this kind of laissez-faire attitude also creates a culture when cheating becomes socially acceptable. And I don't think this should happen. So why don't I talk about COVID-19 and students cheating? How has there been any developments in this respect? And of course, we had to implement new assessment methods and which challenge students to adapt their cheating methods, which they did very well, actually. So my aim here is to let's start with a short buzz group exercise. In groups of 3, think of you are faced with a situation that you have to assess knowledge of students online during the COVID-19 epidemics because you can't do it person to person. What kind of, how would you do it? What kind of method would you devise to test knowledge of students? You have 5 minutes. And the ones that are online, you put your ideas in a chat. Time is over. Shh. So, please, suggestions. Nena, perhaps your group?
We actually went through the techniques that we were using at the department for the past exams.
Yeah.
So we were discussing about the oral exams, which are in a way
Oral, yeah.
one but are online.
Okay.
And whereby they appoint the number of the question they want to answer.
Okay, so oral exam is one option, yeah? Okay. Other ideas, your group rather?
For example.
2 cameras, okay. 2 cameras, okay. Another idea from you?
Sending exam questionnaire by post.
Questions by post?
Answering in, let me say, defined time.
Okay.
Not undefined, but defined.
By
In 1
time.
week or 3 days.
Okay. Janis, yeah?
We were wondering, there are some universities that have online courses and even before COVID, and they have online, also you can pass the exam, but we don't know how they do it.
Mm-hmm. Okay.
So find out.
Yeah.
Find out, yeah. Okay, excellent. This group? Voting system.
Limited time to
Limited
answer.
time, yeah? Okay, Mattea?
We also had this limited time answers as Marco
Okay.
once did.
Okay,
Yeah.
what? The last one, Erika.
Open book examen.
Open
Book examen.
book exam. Okay. Okay. I know I've just asked for you. You had another idea?
Case-related questions.
Case-related question. Case-related questions. What is the group from the chat suggested?
Yeah,
Just 1 or 2?
yes.
Hi.
Clinical case preparing breakout room report on Zoom.
Okay.
Controlling students with the help of video chat.
Control with video chat. Yeah.
So limited time test not only knowledge but also meta knowledge.
Test meta
So
knowledge.
yeah. So do they know what they do and don't know?
Okay.
Video OSCE cases.
Okay. Okay. Thank you. Okay. It's
Yeah,
enough.
okay.
Yeah. Okay. Eva will. So a lot of bright ideas. Okay. Some of them. So what have we done? What we have done is we used examtime.net website, which doesn't allow a student to move outside this field. If it goes out of if the cursor goes out of the field, the test stops. So they can be online, but they cannot. They had to register with Zoom. They had to have the camera on and the microphone on. There was one proctor per 7 students, so everybody was watching you right in the eye. And time per questions were limited, very short time, minimum time per question. So what were the results? The results were good. We were quite happy. You know? The results were comparable to the usual written tests, so we were very happy. We said, okay, fine. Now, I want you to take another row. I want you to take the row of a student. You know that you have to do this kind of a test. You're not prepared and you want to cheat. How would you do it? Again, 3 minutes.
Have
One
no
good
idea.
idea.
I don't know. Huh?
Tough.
Come sono preparato?
All right. Let's start with this side now. And I will leave the online group for the end. So you two start first. Ideas, how would you cheat this test?
Where's microphone?
Just one idea.
So the students fulfill the exam very quickly and give the answers to other students.
Communicate, Tima.
Communicate.
Communicate. Okay. Okay. Another one. Another group. Hidden. Yeah. Yeah. No, say first. Okay. No, wait. Okay. Go ahead.
We Googled how to cheat on exam.net and got an answer.
Yeah.
All you have to do is go to oneworks.net, run an online virtual machine, and then enter the website to go to the exam.
Okay. I can't. Just while.
There's an answer for that specific website, so I guess you can do that.
Website. Website. How to cheat.
Another screen.
All right.
Another screen.
Another? Another screen, yeah? Yeah.
Hidden camera and a helper.
Hidden
in
camera.
In another room.
Yeah. Yeah. Okay.
Maybe identity switch.
Identity switch. You have a devious mind. All right. Anybody else? Eva? Some not to me.
Second. Yeah, smartphone, 2 smartphones, 2 screens, a smart student helping, paying a smart student to answer instead of me, and 2 electronic devices, a body nearby, headphones on the head, pretend to be listening and talk to a smarter student instead.
And so on.
And buying access to exam questions for technical personnel.
Okay.
Robert, dan is hij weg, student.
Okay, so you have you have excellent ideas. What was just
One old one putting the list with answers on the wall.
yeah, okay. What have our students done? They have the Empire Strikes Back. So they use Discord, which is an option where they can share and chat to each other on their smartphones. But first, they complained to the university that the time per test was too short, and which was not legally allowed. So they had to prolong it. So what have we seen in this kind of a test? Not at our department, in other departments. All answers came back in the last 5 minutes. The average score was 9.8 because actually a few students actually tried to answer the test honestly. So clearly we failed. So the lesson is you can't win, you can't break even, and you can't quit the game because you still have to do the assessment. So perhaps can you change the rules of the game? Well, maybe you can, because there are some technical adaptations you can make and take care that this don't happen. Identity switch, there are certain things that you can really make sure that don't happen. Of course, you should use appropriate assessment methods that reflect students' knowledge and thinking, and not just recall of data, which is easy. But the key strategy is to change the students' attitudes towards cheating. And the question is, can we? Are they a reliable partner? Because if you want to do that, you have to do this with students, not against students. You have to stop fighting the students. Are students a reliable partner in education? Are they an ethical group?
Of course. Yes, they are.
Well, this is the bright side. This is our students receiving the award by the President of the State for how they behaved during the epidemic, when they delivered health care to homes of the elderly, and where they held up a helpline for people asking all kinds of questions. So clearly there is a strong ethical note within the students which you have to address. So you have to do another strategy. You have to do the technical approach, how to improve assessment. You have to revise the assessment methods and say, well, actually we are relying too much on data recall. We have to rely on something else. So assessment methods. But the most important is to change the students' attitudes to cheating. So actually what we have seen is the COVID-19, like any other crisis, has brought out the best and the worst in people. Some have done very good, some have done terribly. And it has done the same with students. Some have reacted in a positive way, some have reacted in a negative way. It is extremely difficult to change attitudes through traditional teaching. And actually some curricula are changing attitudes towards worse, not better. Reality, in that respect, reality is better than technology. Personal contact is vastly superior to online communication. It is therefore imperative for the ethics of future doctors to be as close as possible to real life and real doctors who behave ethically and professionally. Practice-based teachers are the most important asset in that respect. They can be the role models, and they usually are, and students are quite aware of that. We must keep students in practice and not in front of computers. Because if we keep them in front of computers, the danger that they will become unethical is greater. The relevance is that since family medicine functions in close contact with real life, and students see their practices-based teachers as their own models. And they are watching us, like in this film by Vittorio De Sica. We should therefore take care of ourselves and our colleagues so that we can be good role models. Our students are watching us and learning us, and they will bring these attitudes to their future life, which will shape their future careers and their future lives. So my final message to you, who are family doctors taking care of students, is just one. Take care and stay safe. Thank you.